Good morning. Good afternoon, everyone. Today you'll hear from myself, Minister of Employment, Workforce Development and Disability Inclusion, as well as Dr. Njoo will give you an update on the state of the country. Please proceed.
Okay. Thank you very much, Minister Qualtrough. Good afternoon. Bonjour. Today I'll talk about some recent trends in COVID-19 transmission and highlight work underway to improve how we care for our elders in long-term care homes. Aujourd'hui, je vais parler de certaines tendances récentes dans la transmission de la COVID-19 et souligner notre travail encore en cours pour améliorer la façon dont nous prenons soin de nos aînés dans les établissements de soins de longue durée. First, we'll begin with the latest numbers. There have been 109,264 cases of COVID-19 in Canada, including 8,827 deaths. 67% of people have now recovered. Labs across Canada have tested over 3,387,000 people for COVID-19 to date. Over the past week, an average of 40,000 people were tested daily, with 1% testing positive. On a signalé 109 264 cas de COVID-19 au Canada, dont 8 827 décès et 67% des personnes infectées sont maintenant rétablies. À ce jour, des laboratoires de tout le Canada ont fait passer un test de dépistage de la COVID-19 à plus de 3 387 000 personnes. Au cours de la dernière semaine, nous avons testé en moyenne 40 000 personnes chaque jour, dont 1% ont reçu un résultat positif. Ces chiffres évoluent rapidement et sont mis à jour quotidiennement en soirée sur le site canada.ca/le coronavirus. When we examine recent trends in case reporting, there is some cause for concern. After a period of steady decline, daily case counts have started to rise. Nationally, an average of 350 cases have been reported per day over the last week, compared to an average daily case count of around 300 in early July. Yesterday, there were over 430 cases reported. This coincides with increasing reports of individuals contracting COVID-19 at parties, nightclubs, and bars, as well as increasing rates of transmission among young Canadians in some jurisdictions across the country. Although severe illness due to COVID-19 is not common among younger age groups, there have been several reports of severe illness among even young and active adults. We are all in this together and have a shared responsibility to help keep COVID-19 transmission low. Lorsque nous examinons les tendances récentes de la notification des cas, il y a une raison de s'inquiéter. Après une période de déclin constant, le nombre de cas quotidiens a commencé à augmenter. À l'échelle nationale, une moyenne de 350 cas ont été signalés par jour au cours de la dernière semaine, contre environ 300 cas par jour vers le début de juillet. Juste hier, plus de 430 cas ont été signalés au Canada. Cela coïncide avec les rapports qui montrent l'augmentation des personnes qui ont contracté la COVID-19 en allant aux fêtes, boîtes de nuit et bars, ainsi que l'augmentation des taux de transmission chez les jeunes Canadiens dans certaines juridictions à travers le pays. Bien qu'une maladie grave due à la COVID-19 ne soit pas courante pour les jeunes, plusieurs cas graves de maladie ont été signalés, même chez des adultes jeunes et actifs. Nous avons tous une responsabilité partagée de contribuer à maintenir la transmission de la COVID-19 à un niveau bas. I encourage everyone, especially young adults, to find creative ways to stay socially active in the time of COVID-19. Singing, mingling, and dancing in close contact with others in closed spaces and crowded places is not the way to party this summer. These are ideal conditions for the spread of COVID-19. J'encourage tout le monde, en particulier les jeunes adultes, à trouver des façons créatives de demeurer actifs sur le plan social à l'époque de la COVID-19. Chanter, se rapprocher et danser en contact étroit avec les autres dans des espaces clos et des endroits bondés, ce n'est pas la bonne façon de faire la fête cet été. Ce sont les conditions idéales pour la propagation de la COVID-19. It's also worth noting that gyms in some parts of the country are starting to reopen too. Whenever you go out to a gym, to shops or bars or restaurants, always follow the guidance of local public health authorities. Look for signs that public health measures are well supported and maintain essential, tried and true practices to lower your risk and the risk to others. These include physical distancing, good hygiene, and keeping your number of close contacts limited to a small and identifiable number of individuals. Il vaut également la peine de noter que dans certaines parties du pays, les gymnases recommencent à accueillir les clients. Si vous allez au gymnase, au magasin, au bar ou au restaurant, suivez toujours les directives et les conseils locaux en matière de santé publique. C'est important de soutenir les mesures de santé publique qui sont bien soutenues et maintenir des pratiques de santé publique éprouvées et essentielles pour réduire votre risque et le risque pour les autres. Il s'agit notamment de pratiquer la distanciation physique, de respecter l'étiquette respiratoire et de limiter votre nombre de contacts étroits à un petit nombre des individus. Now, I'd like to shift our focus to older Canadians. This pandemic has revealed with tragic clarity that residents of long-term care homes are especially vulnerable to the impacts of COVID-19. To date, more than 80% of Canadian deaths attributed to COVID-19 have occurred among residents of long-term care homes. Maintenant, je voudrais concentrer mes remarques sur les Canadiens âgés. Tel qu'il a été tragiquement montré dans cette pandémie, les résidents des maisons de soins de longue durée sont particulièrement vulnérables aux répercussions de la COVID-19. Jusqu'à présent, plus de 80% des décès au Canada attribuables à la COVID-19 sont survenus chez les résidents des maisons de soins de longue durée. My sincere condolences go out to those who are grieving the loss of loved ones. We must do better to care for our elders who are at highest risk of fatal outcomes from COVID-19. This is essential, not only to how our country manages the pandemic, but also to how we, as a society, protect our elders and loved ones in times of crisis, as they have previously done for us. J'offre mes plus sincères condoléances aux personnes qui vivent le deuil de notre cher. Nous devons prendre mieux soin de nos aînés, qui sont les personnes les plus à risque de mourir de la COVID-19. Cela est essentiel non seulement dans la façon dont notre pays gère la pandémie, mais également dans la façon dont nous, à titre de société, protégeons nos aînés et nos êtres chers en temps de crise, comme ils nous ont protégés dans le passé. The Public Health Agency of Canada has published new interim guidance on care of residents in long-term care homes to help providers, facility directors, and administrators prepare, equip, and inform their long-term care home responses regarding important aspects of resident care. L'Agence de la santé publique du Canada a publié de nouvelles lignes directrices provisoires sur les soins aux résidents des maisons de soins de longue durée pour aider les fournisseurs, les administrateurs et les directeurs des établissements à se préparer et à s'outiller, ainsi qu'à orienter les interventions de leurs maisons de soins de longue durée relativement à des aspects importants de la prestation des soins aux résidents. This guidance does not replace individual clinical judgment or specialist consultation and is meant to provide a framework to strengthen care for long-term care residents in the context of the pandemic. This national guidance should also be considered and used in conjunction with guidance provided by provincial and territorial authorities and take into account any relevant provincial, territorial, and local legislation. Ces lignes directrices ne remplacent pas le jugement clinique ni la consultation d'un spécialiste. Ils servent à offrir un cadre qui permet de renforcer les soins dispensés aux résidents des établissements de soins de longue durée dans le contexte de la pandémie. Ces lignes directrices nationales doivent également être prises en compte et appliquées parallèlement aux orientations données par les autorités provinciales et territoriales compte tenu des lois en vigueur à l'échelle provinciale, territoriale et locale. Though the impact of COVID-19 is felt most acutely by the long-term care residents, the impacts also extend to family members, caregivers, and staff in long-term care homes. They too need our understanding and support. Si les répercussions de la COVID-19 sont les plus durement ressenties chez les résidents, des établissements de soins de longue durée, elle touche également les familles des résidents, les aidants et le personnel des maisons de soins de longue durée. Ces personnes ont également besoin de notre compassion et de notre soutien. Caring for long-term care residents during COVID-19 is immensely challenging. Even as we critically examine what has occurred and pursue steps that will lead to better outcomes, we should not fail to recognize the magnitude of the work undertaken by caregivers, staff, and administrators of long-term care homes during COVID-19. Dans le contexte de la COVID-19, il est extrêmement difficile de prendre soin des résidents des établissements de soins de longue durée. Alors que nous examinons d'un œil critique ce qui s'est passé et que nous prenons des mesures qui permettront d'obtenir de meilleurs résultats, nous ne devons pas oublier de reconnaître l'ampleur du travail effectué par les aidants, les membres du personnel et les administrateurs des maisons de soins de longue durée pendant la pandémie de COVID-19. We all need to work together and support one another in order to achieve better results, allowing residents of long-term care homes to live out their remaining years of life with proper care and dignity. Taking care of our elders, especially in long-term care homes, should be our priority as we seek to reduce the severity and mortality of COVID-19 in Canada. Nous devons tous travailler ensemble et nous aider les uns les autres afin d'obtenir de meilleurs résultats et de permettre aux résidents des maisons de soins de longue durée de vivre les dernières années de leur vie avec tous les soins et la dignité qu'ils méritent. Prendre soin de nos aînés, particulièrement dans les maisons de soins de longue durée, devrait être notre priorité alors que nous cherchons à réduire la gravité de la COVID-19 et la mortalité qui y est attribuable au Canada. As Canadians, we must stand up and support those most at risk during their time of need. En tant que Canadiens, nous devons apporter notre soutien aux personnes les plus à risque au moment où elles ont besoin de nous. Thank you. Merci.
Thank you, Dr. Njoo. I'd now like to make a few remarks. C'est un honneur et un plaisir d'être ici aujourd'hui pour cette annonce importante. These last few months have been hard for everyone. We know that persons with disabilities have been facing unique and heightened challenges during the COVID-19 pandemic. From the onset of the pandemic, we've been working with disability organizations and our COVID-19 Disability Advisory Group to better understand the needs and lived experiences of persons with disabilities during the pandemic. We know that people with disabilities are incurring significant additional expenses to safely get food, medication, and other basic necessities. Volunteer and subsidized services have declined, making it harder and more expensive for people with disabilities to get the support they need. For many, this threatens their ability to live independently. This is why last month, the Prime Minister announced a one-time, tax-free payment of $600 to support Canadians with disabilities to assist with extraordinary expenses incurred during the pandemic. Today, our government is announcing its plan to move forward in providing persons with disabilities this support. Je suis heureuse d'annoncer que le gouvernement du Canada proposera des dispositions législatives pour offrir cette prestation et la rendre accessible à un plus grand nombre de personnes. It will now be available to the approximately 1.7 million Canadians with disabilities who have a disability tax credit certificate, who receive the Canada Pension Plan Disability Benefit or the Quebec Pension Plan Disability Benefit, and who receive disability supports provided by Veterans Affairs Canada. And seniors who are eligible for this one-time payment would receive a total of $600 in special payments. In other words, the one-time payment will top up their other emergency payments to equal $600. Si le projet de loi est adopté, les Canadiens admissibles recevraient le paiement automatiquement. Additionally, Canadians with disabilities who are eligible for the disability tax credit but who have not yet applied will have a 60-day window of opportunity to apply for the DTC after the bill receives royal assent. We heard clearly over the past month that many Canadians with disabilities, despite being eligible to apply for the DTC, have not done so for a number of valid reasons. The 60-day application window could increase the number of Canadians receiving the emergency disability payment quite significantly. We'll be working closely with the disability community to ensure that anyone who wants to apply has access and the support they need to do so. This financial support matters. Canadians with disabilities can have confidence that we will bring this project past the finish line. Il s'agit déjà d'un an depuis que la loi canadienne sur l'accessibilité est devenue loi. The Accessible Canada Act has had unanimous support in both the House of Commons and the Senate. I hope that the same spirit will live on and that all parties will support this important piece of draft legislation that will enable this critical emergency financial support to be provided to Canadians with disabilities. I believe that we've taken a disability-inclusive approach to our pandemic response. But I also believe that the delay in getting this money to Canadians with disabilities in this time of pandemic crisis has brought to light shortcomings and barriers within Government of Canada programs and service delivery for our citizens with disabilities, and these need to be addressed. This one-time payment is an important step, but it's just one of many steps that need to be taken to ensure equality of access and opportunity for persons with disabilities in our country. Tout le monde gagne quand chaque Canadien peut apporter une contribution égale à notre société. As we work hard to safely restart and recover from the impacts of COVID-19, we cannot leave anyone behind. Thank you, merci, and we will now take questions.
Merci. Nous allons commencer la période de questions. We'll now take some questions from reporters. One question, one follow-up. We'll start with questions on the phone and then move to the room. So, operator, can we get our first question, please?
Thank you. Merci. Please press star 1 at this time if you would like to ask a question. Veuillez appuyer sur étoile 1 pour poser une question. Our first question, notre première question, is from Christy Kirkup from the Globe and Mail. Please go ahead. À vous la parole.
Hi, good afternoon, Minister, and just wanted to acknowledge your announcement today on important matters related to persons with disabilities. I'm sure it comes as no surprise, though, that my question is not related to that particular announcement today. It is related to the We charity situation, and I'm wondering, when did your government first discuss the potential of an agreement with the We charity?
Thank you, Christy, for the question, and thank you for acknowledging the important day this is for Canadians with disabilities. With respect to the delivery of the Canada Student Service Grant, from the beginning, we heard very loudly from student groups that they needed a package more robust than just income support, which would include an opportunity for them to contribute to their communities in this time of crisis. That was the framework we went into our discussions around student supports. On April 22nd, I personally announced the $9 billion package, which included the income support, the Canada Student Service Grants, changes to our Canada Student Loan and Student Grant programs, and of course the emergency response benefit. And a bunch of jobs. I apologize. I think that it was between that time and rolling up our sleeves and figuring out how to deliver these programs, that we determined a third-party intermediary would be the best course of action, and the advice of the public service was the organization best positions to deliver this robust program and support young people was We Charity.
And just as a follow-up, Minister, I'm wondering, now the Prime Minister and the Finance Minister have apologized for failing to take away themselves from the cabinet table. What do you think of that? Did that put you in a precarious position as a minister at that table discussing the agreement?
Well, both, as you said, the Prime Minister and the Finance Minister have apologized. This was a mistake. We shouldn't have had those voices contributing to the conversation. Having said that, there was robust conversation. Of course, I can't talk about cabinet confidences, but I can assure everyone and all Canadians that at cabinet we were very confident that this was the best way forward for students.
Operator, can we get the next question, please?
Thank you. Merci. Our next question, notre prochaine question, nous vient de Catherine Lévesque avec la presse canadienne. Please go ahead. À vous la parole.
Oui, bonjour à vous deux. Ma première question est pour vous, Madame Qualtrough. J'aimerais savoir pourquoi est-ce que ça a pris un mois avant de présenter un nouveau projet de loi pour aider les personnes handicapées?
Merci pour la question. Nous avons travaillé très fort avec les autres partis de l'opposition, avec la communauté de personnes en situation de handicap pour prendre le temps d'améliorer, d'écouter ce dont ils voulaient additionner à cette loi. Et comme j'ai dit, on va plus de monde va être éligible pour cette paiement. Alors, vraiment, c'est juste une combinaison de travailler avec l'opposition, de travailler avec la communauté, de travailler avec notre groupe consultatif sur le COVID-19 pour être certaine que cette deuxième fois, nous allons livrer pour les Canadiens et deux, ça va être pour plus de Canadiens. Yes, thank you. So the question was about why it took a month to get from the last piece of legislation to this one. From a disability supplement payment point of view, it was a combination of working with the opposition parties, working with the disability community, listening to their concerns, particularly about who we were delivering this to, expanding eligibility, working with our disability advisory group, the combination of all that work together, plus the elements, the additional elements, of course, of the law, the proposed legislation that is now public, I believe. It took that long to make sure everything would be done right.
Suivi, Catherine?
Oui, tout à fait. Et puis, donc, je voulais savoir à quel moment ce serait présenté. Est-ce que ce sera ce mercredi? Et ma question de suivi, c'est pour vous, Dr. Njoo. Sur les bars, on a vu que le Québec a ouvert ses bars et il y a plusieurs jours, en fait, il y a quelques semaines, et puis l'Ontario les ouvre aujourd'hui. À votre avis, est-ce que, vu l'augmentation de cas au Québec, est-ce que la province les a peut-être ouverts un peu trop tôt?
Merci pour la question. Avant de répondre directement à la question des bars, je pense qu'il faut reconnaître le gros effort, les sacrifices que tous les Canadiens et Canadiennes à travers le pays ont fait pendant des mois et des mois. Nous avons réussi, je pense, comme un pays, à aplatir la courbe. Mais je peux dire aussi que notre succès relatif est fragile. Et on voit maintenant, ce que j'ai constaté il y a quelques minutes, que maintenant, on voit aussi que les personnes commencent peut-être à lâcher un peu avec les bonnes pratiques de mesures de santé publique, se laver les mains, garder la distanciation physique et aussi peut-être le port d'une masque si ce n'est pas possible de garder une distance de 2 mètres. Donc, ça, c'est numéro 1. Donc, on sait aussi que c'est important pour les provinces et territoires, au fur et à mesure, et aussi avec beaucoup de prudence, ils commencent à ouvrir, comme on dit, la société, les bars, les restaurants. Et on sait que c'est très important de suivre étroitement qu'est-ce qui se passe avec les cas. C'est important d'avoir une capacité, une infrastructure pour être capable de rapidement diagnostiquer, identifier les cas et aussi avoir aussi un bon système pour le traçage des contacts. Pourquoi j'ai dit avant qu'est-ce qui se passe avec les Canadiens et Canadiennes? Parce qu'en fin de compte, c'est aussi un enjeu de, comment dire, gestion de risques et aussi tolérance de risques à l'échelle individuelle. C'est sûr, le gouvernement à l'échelle locale, mais aussi provinciale, peut avoir des assouplissements des mesures de santé publique, mais finalement, c'est vraiment une question, une décision personnelle. Si on est quelqu'un, il faut décider, est-ce que je veux aller dans une bar, dans un resto? Ce que je peux dire, que c'est avec l'évidence scientifique, on voit maintenant que peut-être le risque est augmenté, plus élevé dans on a dit des espaces clos. J'ai utilisé, comme on dit, l'acronyme BEC, BEC, pour peut-être c'est les situations qu'il faut éviter. BEC pour les endroits bondés avec un rassemblement avec beaucoup de personnes. E pour éviter le contact étroit. Et C pour les espaces clos et aussi les espaces, les endroits avec peut-être pas une bonne ventilation, peut-être mal aérés. Donc, on peut voir que les bars, les restaurants, peut-être sont les environnements, les espaces qui si je parle des trois conditions, c'est difficile. Hein? Donc, je pense que c'est comme un peu d'une expérience et je pense qu'au fur et à mesure, le gouvernement Québec suit de très étroite qu'est-ce qui se passe à l'heure actuelle. Je pense qu'avec quelques cas, et je pense identifiés dans les bars et restaurants à Montréal, on offre le dépistage à tous les les clients, les personnes qui ont fréquenté les bars et on va voir c'est quoi les résultats et j'espère que le gouvernement du Québec va ajuster les mesures dépendant sur les résultats. Merci.
On va prendre une dernière question au téléphone. Opérateur, la prochaine question, s'il vous plaît.
Thank you. Merci. Our next question, prochaine question, nous vient de Mike Blanchfield with the Canadian Press. Please go ahead. À vous la parole.
Yes, question for Dr. Njoo. Just wondering about the emergency stockpiles for Canada's pandemic preparation. They were concerns that Canada was ill prepared. The stockpiles were low. Can you tell us what moves have been made to improve and expand them? And are you confident the stockpile is in better shape now than it was?
Thank you very much for the question. Yes, it's certain that the National Emergency Stockpile System is constantly being reviewed. I would say that at the beginning of all this, there certainly was this, I think, understanding that it was a shared responsibility and still is a shared responsibility between what stockpiles, what type of equipment provinces and territories should have sort of at their disposal, for example, personal protective equipment, and also to what degree the National Emergency Strategic Stockpile from the federal government should be there sort of in reserve for surge capacity. And that's something we've learned as we've gone along. I think some hard lessons in terms of what we could do collectively to improve for the future. I think the case in point with personal protective equipment, I think, hindsight's 2020. I think, to be quite honest, no one could have imagined with this unprecedented pandemic that, we could or should have had in a stockpile like, 200 million or so, individual, N95 masks. I think at the time we were looking at sort of the usual sort of supply chain logistics and thinking that, okay, if we had a certain amount in the National Emergency Strategic Stockpile, as well as what's obviously in provincial and territorial reserves, we're well positioned should we need to order more. But as we saw with what happened internationally, globally, it was a very tight marketplace. As I think others have mentioned, it was like the Wild West in terms of trying to secure, PPE for all the healthcare workers and others who needed it. So I think what we've learned from that is that I think the federal government, along with the provinces and territories, we put our best efforts forward in terms of getting the PPE that was necessary, and we're still doing that at the present time. However, we've also learned that we can't, in the future, necessarily depend solely on sort of a globalized supply chains. We have to be more self-sufficient, and that speaks to the innovation that we've obviously undertaken here in Canada with ensuring and building up a capacity for domestic production. So I think those are some of the things that we've learned as we've gone along, and I certainly feel better about, I think, our situation the way we are, where we are now compared to, let's say, back in January, February, and certainly we'll continue to review and improve as we go along.
Mike, do you have a follow-up?
Yeah, my follow-up is related back to what Dr. Njoo said a moment ago about how to party this summer. Given the messages that you've been trying to give to Canadians, given the risks to seniors that you've again, the devastating impact on seniors that you've again outlined today, what explanation do you have for the fact that people in great numbers couldn't follow scientific medical advice that you were giving in the spectacle that we saw of what happened in Quebec bars, and how concerned are you that Ontario is setting the stage for a repeat starting today?
Thank you for a good question. There's a lot in there. I would say that, I'm not a behavioral science expert, but certainly we've been working closely with those who are more, I think, expert in behavioral science to understand what drives human behavior. I think by and large, most Canadians, certainly during the winter months, were very, very good in terms of understanding, appreciating, quote, the scientific advice. And as the country was in lockdown, keeping themselves limited as much as possible to their homes, maintaining a tight social bubble, the good hand hygiene, physical distancing, and of course later on the use of face coverings and masks. But I think with anything, there's always, I think, a bit of a fatigue factor, and certainly I think that's come into play a bit now, especially with the warmer weather and people getting out and starting to, I think, get out of their cabin fever, if I can call it that. But the other aspect, which I think I highlighted and I would like to focus on, is also, I think, the issue of young adults. Certainly, I think it is concerning that we're seeing the data show us that a greater proportion of our cases are now among what we call young adults, those are less than 40. And I think part of that is something that I think all of us, myself, I was young once, and I can remember that when I was younger, I thought I was invincible. You can do anything. Don't worry about it. It'll be okay. I think a part of the reality today also is that we also recognize, and I think the young people have also seen that COVID-19 in terms of, everyone's equally susceptible to the risk of getting COVID-19, but in terms of the health outcomes, it is true that overall young people tend to not have at the same rate serious health consequences compared to older people and those with underlying medical conditions. Having said that, I think we have seen some anecdotes of young people having severe outcomes. So you can't consider that everyone is sort of immune from having serious consequences. I think we've even seen in the press, celebrities and so on that have had unfortunately serious outcomes. But I think that the other part that's also very concerning is that with the young people, even if they may have a mild illness or even be asymptomatic, they of course are part of our society, and they obviously go to the workplace. Maybe they work in a fast food restaurant. They obviously have parents and grandparents, so that the possibilities of them transmitting or being in contact with others is what I think is a major issue. Certainly, I would tell young people, including my own kids. I have 3 kids in their 20s. They've heard it 100 times from me already. Hey, you need to also take some personal responsibility. It's not only to protect your health, but to protect the health of all others in our society. And I think people understand that, get that. I certainly, when I've gone out, I've seen many young people actually take the right precautions in terms of face coverings, using their hand sanitizer, keeping their physical distancing. And I think it's just something that we need to keep, unfortunately, hammering home, because until we actually get an effective vaccine or treatment, these are the only things we have at our disposal in terms of slowing down or at least limiting the transmission of COVID-19.
Okay, we'll now move to the room. David, CBC.
You were young once. How old are you? So I'm just wondering, as restrictions are relaxed, what is your red line? What are things that you can do now that you're permitted to do in Ontario and, if you travel to Quebec, that you won't do because it's too risky?
I think, as I mentioned before, I think at the end of the day, governments, public health officials can always put forward guidance. And obviously, in the case of governments, they can actually use regulation or legislative means to try and limit the possibility of further transmission of COVID-19. But at the end of the day, I would really say it comes down to individual, sort of personal responsibility for all Canadians. And I think it also then comes down to the matter of what I would call individual risk assessment and risk tolerance. I can't speak for anybody else in terms of, what my own personal risk tolerance level is compared to someone else. Someone else, if they take all the right precautions, wear a face mask, hand sanitizer, etc., they may feel comfortable going into a bar. That's their choice, and they need to understand what the risks might be as we give them the scientific evidence about, ventilation and, how, I think I even mentioned that, if you go into a bar with the best of intentions, wearing your face covering, making sure you're keeping your physical distancing, maybe after 1 or 2 drinks, maybe your inhibitions and your judgment might be not the same as it was when you first entered the bar. For me personally, at the present time, as someone asked me the question, I'm looking forward to the NHL resuming. I'm a big sports fan, but I'll be doing it in sort of my own tight social bubble and watching the games at home. So that gives you an idea in terms of my own personal risk tolerance level, but I really can't make that call or make that choice or decision for others.
Okay, no patios for you. So, but that's perfect segue.
Okay.
Do you want to answer that?
For patios? I would say that compared to being indoors, I would probably have a higher comfort level with that. I would still say that for the time being, and certainly what I've done is that my outdoor activities in terms of eating have been restricted to, I think, family barbecues with physical distancing in my backyard with my tight social bubble But outdoor patios and so on, I think if there's proper distancing and all the other measures put in place, hand sanitizer, people, respecting, the other good public health measures, then I think I would be more comfortable. I think the other way to look at it is that certainly from the scientific evidence, what we've seen is that indoor spaces are at higher risk. And I think I've used the analogy before of cigarettes and cigarette smoke. So if you just look at, we can actually see a cloud of, cigarette smoke. And if you were outside with a smoker, and I'll tell you right now, I'm a sort of a strongly anti-tobacco. I'm a public health person, so that's another aside. But if you were beside a smoker, and none of my friends are smokers, by the way, then if someone were to smoke, you could see if you're outdoors on a patio and you're, there's good air currents, that the smoke would dissipate much more rapidly, and you wouldn't really be exposed to it for a long time. So that might be the same way you might think about your potential exposure to small or aerosolized droplets of COVID-19. However, if you were indoors in a restaurant or a bar, completely different situation. If you were in close sort of proximity or contact with a smoker, that cloud of smoke certainly lingers for a longer period of time, and your potential exposure is increased. And so we can think of that, the analogy of cigarette smoke in the same way for COVID-19. So if the question is, am I more comfortable on a patio outside compared to being indoors, I would say yes, and that's the reason why.
Now for my real follow-up.
Oh, really?
Okay. Baseball. The Ontario government, a minister in that government, is confirming that they have received the final clearance and that everything is, let me just read the headline really quickly, they're all clear to play at home. Can you give us an update on that? What's the federal government's position? What's your, are they just going to be able to play here and travel, and are teams going to be able to come here and play?
If we've got the time to give you a long answer, I would say that the short answer is that the federal government, obviously, we're still looking very closely at the proposal put forward by both, Blue Jays and Major League Baseball. And certainly we've had good discussions, conversations involving both local officials from the City of Toronto as well as provincial officials, the Blue Jays and Major League Baseball. I think I'll just give you a couple of thoughts. Going back, stepping back, I would say again, hey, Canada, we've done a good job overall, relative in terms of flattening the curve. Look at where we are right now, about 300 or so cases per day. But that success that we've achieved, I think, is fragile. As we've seen, it just takes a few sparks, and we can easily backslide to having many more cases. So that's something we need to keep in mind. As part of that, risk management, if I can call it that, for COVID-19 in Canada, we've done a good job in terms of, keeping our house in order here. And so the other thing we need to look at is that how do we manage the risk of importation of COVID-19 from elsewhere? And so certainly from a federal government perspective, one of the key things we're responsible for is the International Border and the Quarantine Act. And what I would say also is that, at the present time, what we know about the disease, the 14-day incubation period, that's why we have this very, I think strict, but, reasonable sort of obligatory 14-day quarantine for anyone who comes from outside who comes into Canada, so that we can keep track and make sure that they don't import the risk of having COVID-19. After the 14-day quarantine, with the sort of the understanding that they're clear of the virus, then of course we expect them to follow all the public health measures to not be at further risk of exposure. So that's the thinking from, I think, a federal government perspective in the Quarantine Act. So here we are looking at the epidemiology of COVID-19 in Canada, and we all know what the epidemiology is of COVID-19 in the United States. Looking at the plans of Major League Baseball, I would also maybe in some ways say that, hey, looking at all professional sports, all of the plans submitted, there's none that's risk-free. In essence, life is not risk-free. So it's all, again, a matter of risk management. For the NHL model, I think it's closer to what we would be comfortable with in the federal government because, as you can see, they've chosen the 2 hub cities in Canada. All the players and all the essential personnel involved with the production of the games have crossed the border into Canada, have observed that 14-day quarantine in terms of their training, and then we would maintain that tight bubble in terms of regular testing, making sure that there's no risk of exposure, keeping them, obviously, the players and essential staff separated from the general public. In the case of Major League Baseball, what the construct is that, the teams and the Blue Jays included would be during the regular season traveling back and forth across the international border. And that, I think, is an issue. And I think to their credit, the initial plan from the Blue Jays submitted to us had them during the regular season, as opposed to the training camp where we had permitted them to come in because it was a tight bubble, a 14-day sort of modified work quarantine, staying, strictly to the hotel and sort of the, Rogers Center in terms of training. During the regular season, the proposal initially was, they can just live in their condo or summer residence and so on and be part of the community. I think it's to their credit that the Blue Jays understand how seriously we're taking COVID-19 here in Canada and the measures we've put in place and why we as a country have, I think, relatively successfully managed COVID-19 in Canada. And so the modified proposal from their perspective is that they would also maintain that quarantine bubble even through the regular season. So should they go to the U.S. For games and come back, they would still maintain that tight bubble. There'd be no family members coming to join them, etc. So kudos to the Blue Jays for, I think, making that acknowledgement and also the commitment, making that sacrifice, if you want to call it, in terms of what they're prepared to do during the regular season. But the fact remains, the Blue Jays, if they go across the border, I'm a sports fan. I know where they'll be going to play games. Florida, there's the Tampa Bay Rays, the Florida Marlins. Look at the Atlanta team in Georgia. And then, of course, with the construct of Major League Baseball at the present time, you've got the other teams coming up to Canada. And certainly, I don't think they're under the same tight sort of bubble in terms of what they're doing in their home cities as what we're doing here in Canada. So those are some of the factors that are certainly in play as we make our continue our deliberations here at the federal government level. Thank you.
Okay. Next question, Mackenzie, CTV.
Hi, Mackenzie Gray with CTV News. Ms. Qualtrough, my questions are for you. On the We Charity front, how many times has We Charity submitted unsolicited proposals to you, your office, or your department? And how many times have you spoken with anyone from We about the Canada Student Grant Program or any other issues?
I'll answer your second question first. I have not spoken with anybody at We. This was not my file to carry. I had the other student measures and the jobs, the student benefit, and the student loans and grants. In terms of the exact number of unsolicited proposal, I don't actually know the answer to that. It's very common to get unsolicited proposals from organizations, particularly organizations that have worked with the government before. So I can get that information for you. I just don't know the answer.
So it's fair to say that we had sent multiple ideas to you on that front. And my follow-up is, We is having conversations with the government. They are submitting these unsolicited proposals. And the government is having conversations with We about issues of fairly substantial sums of money. But We is not registered to lobby the federal government. Do you think that's an issue that We is not registered? And why did the federal government and people who potentially were working in your department, I'm not 100% sure, know that We was not registered to have those conversations?
Let me clarify. I can't tell you if there's been multiple. The two I know of are one with respect to youth entrepreneurship and one with respect to the Canada Student Service Grant. My office, I did not receive those in our office, but I do understand that they were distributed to other ministerial offices. I just don't know the details of it. I was not involved to that extent with this file. And I can't remember your second question. I apologize.
Lobbying and the fact that they weren't registered.
Hey, listen, I think we should always err on the side of caution. If you are in the business and if your core business is lobbying the government of Canada on a particular issue, you should be registered with the lobbyists. But it's, again, not my area of expertise. And it's something perhaps that any organization may want to look into themselves.
I want to clarify one really quick thing. A report or a proposal for the Canada Student Grant Program to the government, correct?
Yes, as was testified to yesterday by the Minister of Diversity, Inclusion and Youth, the government of Canada did receive unsolicited proposal from We Charity the day of the Prime Minister's announcement of the $9 billion student package.
Okay. We're going to move back to the phone. Operator, can we get, do we have any questions?
Thank you. Merci. Our last question is from Marie Vestel avec Le Devoir. Please go ahead. À vous la parole.
Oui, bonjour, Dr. Njoo. J'aimerais revenir sur les restaurants et les bars. Vous avez clairement indiqué qu'il y a des risques associés au fait que c'est des espaces clos. Des fois, il y a des problèmes ou en tout cas, la ventilation n'est pas idéale. Sachant ça, est-ce qu'il est adéquat que les bars et les restaurants soient ouverts dans certaines provinces en ce moment?
Merci pour la question. Je pense que c'est vraiment une décision à prendre pour les autorités des provinces et territoires parce que c'est eux, ils sont plus, comme on dit, sur le terrain. Ils ont le contexte aussi, l'épidémiologie avec qu'est-ce qui se passe actuellement dans leur administration. Pour moi, c'est difficile parce que on peut parler vraiment d'un cas individuellement d'un restaurant. C'est possible qu'un restaurant a une bonne ventilation, des autres facteurs. Et c'est tous les facteurs que les autorités à l'échelle des provinces et territoires doivent considérer. Ce n'est pas vraiment pour moi pour commenter, dire quelque chose à travers le pays.
Question de suivi, Marie?
Vous dites que le nombre de cas est en train d'augmenter au pays et puis vous faites un lien avec les activités des jeunes en citant le cas des bars. Est-ce que vous avez un seuil ou est-ce que vous surveillez la situation attentivement et jusqu'à combien de cas par jour est-ce qu'on peut monter avant qu'il y ait réellement un problème et qu'on recommande de reconfiner certaines de ces activités-là?
Merci pour la question. Je pense qu'il n'y a pas comme un chiffre exact. C'est vraiment une question d'examiner qu'est-ce qui se passe actuellement à l'heure actuelle dans chaque province et territoire, mais aussi à l'échelle locale, municipale. Nous continuons nos discussions dans le comité consultatif spécial avec nos homologues des provinces et territoires. Et c'est sûr, c'est eux qui suivent la situation dans leur administration attentivement et étroitement. Nous autres, c'est intéressant parce qu'en partageant nos expériences dans toutes les provinces et territoires, parce qu'une expérience dans une province peut aider peut-être les autorités dans une autre province pour les mesures à prendre. Par exemple, c'est une autre situation, mais on sait que la Colombie-Britannique et le Québec a aussi ouvert leurs écoles d'une façon limitée pendant le printemps. Et maintenant, toutes les provinces et territoires, aussi nous autres à l'échelle fédérale, on a discuté, on a vu c'est quoi les résultats de leur expérience dans les deux provinces parce que ça va aider avec les données probantes aussi, l'évidence pour aider toutes les provinces et territoires pour qu'est-ce qu'ils peut-être veulent faire pour l'automne et les écoles.
Thank you. That concludes today's press conference. Merci.